Introduce yourself. Okay, thank you, Pam. If you haven't before, if you think you're new, we don't know you or you're new here, please do add your email address in the chat box so that you can go on to our list of people that receive all our things we send out and get invited to the meeting. Pam's going to mute all microphones if she hasn't already. And but there will be an opportunity to ask questions, and Maria has kindly offered to monitor these questions, and we find it's much easier if somebody like Marianne actually collects the questions and maybe collates them and puts them to our speakers rather than everybody do a chat, because it just takes up so much time, and we really do want to spend all our time listening. Okay, well, Eileen says I need to talk for 5 minutes, and once I start talking I don't stop, so I shall stop now. and we'll go on. Have I forgotten anything, Pam? Do I need to say anything else? No, I'm all right. Jolly good. Okay, so we'll start off with our first speaker, Marianne. And would you like to just introduce yourself and tell us all about what you do? Thank you.
Yeah. So hi, my name's Marianne Carey. I work as a commissioning manager in the planned care team, working in North and Mid Hampshire for Hampshire and the Isle of Wight Integrated Care Board. And I'm here with my colleague Zoe Collinson, who Zoe has put together a presentation this morning for us that both of us are going to present. So thank you, Zoe. I don't know if you want to introduce yourself as well.
Yeah, morning everyone. So I'm Zoe. I'm the Assistant Commissioning Manager in the Planned Care team for North and Mid Hampshire, so working alongside Marianne. So I'll just share my screen.
Mm-hmm. We're so used to Teams, the Teams, so when we come on a Zoom call, we just have to get used to where all the buttons are, everyone.
Yeah, I was just about to say that. I'm sorry if I messed this up. I think I've got it. Can everyone see that okay?
Yes.
Let me share. I'll actually play the presentation.
Thanks, Zoe. You've done a
okay.
Brilliant job with the technology so far this morning.
Absolutely excellent.
Oh, sorry, man.
Oh, no, I was just going to say, so we're here to talk about the latest integrated care strategy that was shared basically from December. And so we were just going to try and put a little bit of context on it about what we're doing locally, sort of what some of the projects Zoe and I are involved with, and how it kind of fits in for patients as well.
So to start with, we've just kind of done a summary slide just around what the ICS is, so what Hampshire and the Isle of Wight Integrated Care System is. So it was formally created at the end of last year, and it basically allows organisations to come together to plan and deliver more unified health and care services. So this slide just really provides a visual as to what the type of organisations and partnerships are a part of the integrated care system. So you can see that we serve a population of 1.9 million. There are 4 acute trusts, 140 GP practices, 4 local authorities, and 1 ambulance service, and multiple voluntary and community partnerships as well as part of that, and many other different types of organisations. So these system partners have basically come together to develop a strategy which sets out how we and our partners are going to work together to improve not only the health but also the wealth and well-being of the local people and the communities across the Hampshire and Isle of Wight system. Just go on to the next slide, and then pass over to Marianne.
Yeah, so with the strategy, so there's some main aims of the strategy. So around improving outcomes for population health and healthcare. So looking at our local population, we're quite lucky in North and Mid Hampshire because we have a health improvement and place team, which actually in planned care, so there's different sort of teams in our North and Mid Hampshire area. Zoe and I work in planned care, but we have like a health improvement and place team as well. So we're trying to work in a much more integrated way and kind of work across and kind of teams and really kind of come together collaboratively to kind of deliver some of this. Tackling inequalities in outcomes, experience and access for patients. So, you know, we know that there are some deprived areas of North and Mid Hampshire, which that's where like the health improvement and place team will look at working with local organisations and communities, which is then helpful for us in planned care. If we're looking at cancer services, for example, for patients, you know, how are patients being supported in their local community? How can we improve access and patient experience? And it's brilliant being able to feed into the Cancer Services Partnership here, this patient group as well, to help kind of shape some of these services and get patient feedback. Looking at enhancing productivity and value for money as well. And again, making sure that where services are placed, is that the best place for them? Is that, well, are patients kind of finding that accessible, and is it meeting the needs of the population as well? So taking that community-centered approach to wellbeing as well. And I think that's definitely, I've been working in the ICB for 3 years. Before that, I worked in health intervention programs, like setting up cancer rehabilitation schemes and long-term health condition classes to tackle sort of health inequalities and things in the borough of Eastleigh in Hampshire. So it's really interesting coming over and working in the ICB here, because there's definitely more connections now. We're trying to connect up into the community, more conversations about organisations, people, the NHS not working in silos, but kind of coming together and joining up our resources and making sure patients as well are supported in the community. So not necessarily always having to go into an acute setting for support. And in terms of sort of the different priorities and key areas of focus of the strategy, there's like children and young people, which is a big part, mental well-being. So there are a number of patients that have long-term health conditions in North and Mid Hampshire, and some of the data has shown that 30% of people with a long-term health condition have been reported to have a mental health condition, and with anxiety and things as well. So again, that's where one of the focuses is around mental health and looking actually what can we do as an integrated care board to support patients. So good health and proactive care as well. So looking at proactive care, so that's that ongoing patient and provider conversation, so active monitoring of patients as well, and supporting a healthy aging and people living with different conditions such as frailty. We have quite in North and Mid sort of an older population as well. So again, working with the primary care networks, so the PCNs, so primary care networks across North and Mid Hampshire, looking at the population health. So what actually within a primary care network, the health and needs of the local population that primary care network would serve. Looking at our workforce as well, and also sort of digital solutions, data and insights. I think, I mean, COVID has, as we all know, it's kind of made some changes. Some of them, you know, have been helpful in terms of, for example, this meeting this morning, we can have it virtually. I do believe there's absolutely always a place for face-to-face contact and things like that, but it is helpful as well. Some services being developed that can be virtual to access more patients and people, and also bring the workforce together more. So if you move on to the next slide, Zoe, if that's okay.
Yeah. So the strategy also just sets out the benefits of focusing on these 5 key areas, as Marianne talked through. So these, we've just picked out basically some of the benefits and pop them on the slide for you, but I'll just talk you through a few of them. So one of the benefits is around kind of joining up services, as Marianne mentioned, to improve patients' experiences. So for example, they only need to say things once and they don't need to continually kind of repeating their story to different healthcare professionals. Also around improving kind of mental and physical well-being for patients, so people can live longer, but they also live healthier lives. The benefits around kind of improving social connectiveness within our communities, and establishing a kind of network of support around patients, and giving the patients more control over their care, and as well as just harnessing kind of the support and benefits of the voluntary sector kind of as the CSP do, and working with our partners as a system rather than kind of independently from each other.
Thanks, Zoe. And then, so in terms of, I quite like this slide because I think it shows lots of different, it won't be all the partners, but lots of different partners across that help develop the strategy. And I mean, Zoe and I, in our line of work, we in planned care, we certainly try and connect up more to local organisations and communities to help sort of improve some of the services that are commissioned for patients and services. So, for example, like later on this meeting, Sarah Quarterman, the Chief Executive at Alton and Basingstoke Cardiac Rehab Centres, here to talk about how their centre, their charity, can help support patients in North and Mid Hampshire and actually wider as well, because they actually have a number of very highly qualified staff and exercise instructors who are cancer trained as well to work on the prehabilitation and rehab side for cancer patients. It isn't just a cardiac rehab centre, and also works on prevention as well. So I'll let Sarah kind of talk about that later on. But for example, some of the work in planned care that we've been doing, working with Hampshire hospitals, with the cardiac rehab team. Zoe and I don't just work with cancer, we work with the cardiology team as well. But during COVID, the phase 3, sort of the NHS cardiac rehab classes were halted. The hospital, the physio gym was set up as a ward, so the patients weren't getting their exercise rehab and things. So and actually there'd been some discussions about moving those classes out into the community for accessibility for patients. It's easier to park and everything. So Zoe and I worked with the lead cardiac rehab nurse at Hampshire hospitals, and we've managed to move the classes into a community setting with some of the leisure centres, which the leisure centres have been really supportive of the NHS being in their centre and kind of offering sort of classes. For example, when patients have completed their cardiac rehab, they can then go into community classes as well, and it's broken down some of those barriers. It's more accessible for patients, it's much easier to park, it's cheaper to park, some of them are free to park in some of these centres. And they're exercising in a lovely studio and things. So there's been sort of lots of benefits on that. And again, I think it's joining up some of these services, looking how we can work with like voluntary organisations as well, and patient groups too, the local council. So yeah, so that just sort of gives you a little bit of an insight. So this strategy, I mean, we kind of feed into this strategy. This is being developed throughout 2023, Zoe and I believe. So we're happy to update on this meeting sort of when we get more information and things like that, to kind of help to bring that to life a bit more. So it's yeah, if that's useful. So yeah, if there's any questions, feel free to let us know. And our email addresses are there. And thanks again, Zoe, for putting that fantastic presentation together.
Well, thank you very much. Do we have any questions at the moment? I don't think so. So if you think of anything as you go along, just pop it in the chat box and we can address it later. I'm just so grateful for you to come along. There are so many things happening that not everybody is aware of, and you know, it's just so good for you to come along and keep us up to date. And so I think if there's nothing else to say, I shall move on to our next speaker, which is Katie Thompson. Katie, would you like to actually introduce yourself?
Yes. So I've met some of you before, but for those that don't know me, my name's Katie Thompson. I've recently started as the operational manager for haemophilia, haematology and oncology. Bit of a long-winded title. But my role really is to lead on strategy, service improvement and kind of the operational performance of some of the key cancer services at HHFT. So today I'm going to present on just a bit of an oversight on HHFT cancer services. So I will share my screen. Everybody see that okay? And let me, oh, sorry, just bear with me. Right, there we go.
Ah, well done.
It's always the nerve-wracking bit, isn't it? So as I said, a bit of an overview on cancer services. There we go. So I thought I'd start by sort of introducing you to the main management team within cancer services. So Emily Arbuthnot is the head of cancer services. She's worked at HHFT for a long time and oversees absolutely everything within cancer services now. And importantly, she's also accountable for cancer performance for the entire trust. So has lots of dealings outside of cancer services. So if we start by going to cancer performance, so Kat leads on cancer performance as our cancer performance manager. So that service is in place to ensure that cancer patients are diagnosed and treated as quickly as possible. So there's a big focus on targets that you might have heard of and making sure that there aren't any delays to the pathway. She also manages our pathway coordinators, whose job, again, is to make sure that there aren't any delays to the pathways, and also our new roles, which are pathway navigators. So we're quite excited about these roles, as I think they can have a really great impact on our patients. So they work much more closely with patients, as I think the cancer performance team sort of sits in the background, and as patients, you don't have many, if any, interactions with them. The pathway navigators are slightly different, and it's a much more supportive role designed to help patients navigate our very complex NHS systems that are very normal to us, but to patients are not. It is not normal, and it's a much more supportive role, and there to support you through the whole pathway. So we currently have 6 pathway navigators in post, which is supported by the Wessex Cancer Alliance. So these roles are developing as they are new roles. So, but we're having really positive feedback about those at the moment. So moving on, as I've mentioned, I'm the operational manager for haematology and oncology within cancer services. I also manage haemophilia, which is not a cancer specialty, but is closely linked to haematology. So yeah, I lead on performance and strategy for these areas. So Ruthie is going to be presenting next, is our cancer services matron, and is responsible for the Rainbow units, Wessex ward and our cancer service clinical nurse specialists. I won't go into too much detail about those, as Ruth will be talking through those next. We then have Emma, who is our lead acute oncology service nurse. So this is a really great service that we have in place for patients undergoing chemotherapy. So the service is designed for patients that are currently undergoing treatment and is a support service if there are any complications of that treatment, if there are any concerns or queries, or if you become unwell whilst you're undergoing treatment. And the idea of this service is that you will be able to get straight through to a specialist that knows you, that's an expert in your condition, and so that you avoid having to wait in the emergency department or having to contact your GP. So it's a direct link for our patients. Next, we have our Wellbeing and Supportive Care service, which I know Julie's going to talk through, so I won't go too much into detail with that either. And then we have our oncology team. So our oncology team is made up of clinical and medical oncologists. So the main difference between the two, so our clinical oncologists also offer radiotherapy, and our medical oncologists tend to focus more on the chemotherapy. So our clinical oncologists are employed by Southampton Hospital, as the radiotherapy service sits within Southampton, although it is on the Basingstoke site. So that's the main reason. One of the other reasons for that is that Southampton tend to offer the more radical radiotherapy treatment, and we therefore want to work more collaboratively, but also the idea is that it would hopefully be more attractive to clinical oncologists so that they could also do some of the more radical treatments. Unfortunately, we do have a couple of vacancies for our clinical oncologists, which is incredibly hard to recruit to, and we are continuing to work with Southampton to try and recruit into those posts. So our haematology team next, so they are based on our Wessex ward. So our haematology service treat patients with all types of blood disorders. So the majority of our patients do have cancer. However, we do treat other blood disorders as well. So they have specialist interest in lymphoma, myeloma and transfusion, and they also hold their regular haematology clinics, which are in the Rainbow unit. And we also provide those clinics in community hubs, so in Alton and Andover. And I will just touch on peritoneal malignancy. So Megan is the peritoneal malignancy service manager. So that sits within cancer. So peritoneal malignancy is a specialist cancer unit. So they treat one of the diseases they're most commonly known for is treating a very rare appendix cancer called pseudomyxoma peritonei. And they also treat other cancers which have spread into the peritoneum. So they are actually one of two centres in the UK and the largest volume centre in the world. So we have lots of links around the world that come to Basingstoke to learn what we do here. So it's a really great service to have at Basingstoke Hospital. And then finally, just to talk through some of our clinical leads. So we're very excited for Lisa to be joining us from April, who is starting as our Macmillan lead cancer nurse. So she will really focus on the strategy, the clinical strategy, and really driving that forward. We also have Sarah Mangles, who's our clinical director for cancer services. So she works very closely alongside me to really drive forward what we want to do. And then we have a few other clinical leads. So we have Mariana, who leads on haematology, Katie on chemotherapy, and Aaron on the acute oncology service. So we have some really, really great leaders. We have a really good, well-structured management team now, which we are hoping is going to really drive service improvement over the next year. So what I thought might be a really good way to put some of that into context, because although I can sit and talk about cancer services and the teams that make up cancer services, there are so many more teams that are involved with a cancer pathway. So I thought we could look at just a very sort of generic cancer pathway and talk through the different teams that are involved along the way. So if I start with the referral, so that is the first service you might come into contact with is your specialty team. So that will be an expert into the potential condition that our patients might have. So that could be lung, colorectal, haematology, any of those sort of services. This is when the performance team will first become involved in the pathway. So they will start your clock and make sure that you are seen within 2 weeks, also keeping track of any potential issues and delays and escalating that to the clinical team. Next, you might have an appointment, so that might be with your specialty team, which would be in our outpatients. And you'll find that along this pathway, the performance team sort of sit in the background, kind of monitoring all the way along. So you may not have an appointment first, you may just go straight to investigations, and there are lots of different teams involved with this. So you might have a scan with our radiology team, you might have a blood test taken by one of our phlebotomists, or the specialty team might have their own investigations that they wanted to do. You may also have an endoscopy or a colonoscopy that would be done by our endoscopy team. The next stage would be a diagnosis. So collectively, the specialty team would work together with the radiologists who might review your scans, the pathology team who might look at your bloods or any biopsies and other investigations, come together, look at those results to get to a diagnosis. The next step, which I'm sure many of us are familiar with, is the MDT, so the multidisciplinary team. So this is where lots of different people get involved. So you would then be discussed in our MDT. So that would involve your specialty team, radiologists, pathologists, oncologists, clinical nurse specialists, and what we call AHPs, so physiotherapists, dietitians, occupational therapists. So collectively, again, they would look at all of the investigations and come to a decision and create a treatment plan for the patient. So the performance team also attend these meetings. They coordinate the meetings and make sure to highlight any potential delays or any hiccups along the way to the clinical team. So it's a real collaborative approach to creating a treatment plan for our patients. Next is the treatment. So again, this varies for everybody. So you might have surgical treatment, which would obviously involve your specialty team and a team of surgeons, or you might have surgery followed by chemotherapy, or maybe just chemotherapy. So our chemotherapy takes place in our rainbow units, and that's all facilitated by our oncology teams. You might also have radiotherapy, which, as I mentioned, is run by Southampton, but is based at Basingstoke Hospital. And then our clinical nurse specialists, they're the ones that are here all throughout the entire process, supporting our patients along the way. So after treatment, we go into living with and beyond cancer. So again, after treatment, you might have follow-up. This obviously differs for every patient and might involve your oncologist. It might involve just your specialty team. So you might have regular scans, which are undertaken by our radiology teams, and your CNSs would continue to support you post-treatment. And then our AHPs, so our physios, our dietitians, again, have a massive part to play in supporting our patients after they receive their treatment. And I will obviously mention our supportive care and wellbeing service, which Julie's going to talk through a little bit later on. So I think it was important for me to talk through that, because what it does is it makes it very clear that there's a huge number of teams involved that don't all sit within cancer services. But as a trust, we work really, really closely with them. And obviously there's lots more teams behind the scenes, which I haven't mentioned. So our domestics and our ward nurses and everybody that's involved with our patient care. And then I thought a great way to end my talk, which is focus on our priorities for the future. So to talk about a few things that are certainly on my radar as the operational manager. So one of the first projects I'll talk about is our chemotherapy closer to home. So we have a new project lead for that. So she's going to be starting soon. And really this project's looking at how we can provide treatment in a location much more suitable for our patients. So whether that might be in community hubs, at GP surgeries, or even in a patient's home, depending on the treatment. So that's a real key area of focus for us. We are also very lucky to be able to do a refurb in our rainbow unit at Basingstoke, which we're very excited about. So we are looking to redesign the internal structure of the rainbow unit, which is being funded by the Art Cancer Charity, Cancer Centre Charity. So that's ongoing at the moment, and the aim of that is to make it a much better environment for our patients and as well as our staff as well. The third point I wanted to focus on was personalised stratified follow-up, another NHS abbreviation. So some people refer to it as PIFU, which is patient initiated follow-up, and it is really focusing on creating a follow-up plan that is personalised to an individual's needs, so that it's not a one-size-fits-all service. And also it ensures that our patients are able to access the help that they need quite quickly. So it's giving us rapid access to support should they be worried that their cancer might be recurring, or if they have any queries at all, and that would be initiated by the patient with a key link back into the trust. And finally, Fit for You is another project that we'd like to focus on. So that is a personalised rehab programme for patients who are within the last 12 months of their life. So patients would be assessed and given a 12-month care plan, which focuses around dietary and exercise needs, as well as emotional support. And really the aim of this project is to reduce the time in hospital for patients, as well as it really improving quality of life for our patients that are within the last 12 months of their life. So those are just a few of their projects. Bearing in mind, I've only been here for a month, so I'm sure there'll be lots more. But yeah, if there's any questions.
There are some questions in the chat, if that's okay, Katie, and thank you. That was such a great presentation. I think it's really good to have that sort of oversight of everything and information. So I've got a question about is a cancer patient allocated to a dedicated pathway navigator?
Yes, so we have pathway navigators that work within specific specialties. So everybody within that specialty will go to that pathway navigator, just because different specialties have very different pathways. So that's the way that we've done it, and they would have their own dedicated navigator. So you can really build that relationship with them. We've had, I recently attended a Wessex Cancer Alliance workforce conference, and we were talking about these roles, and actually, you know, as far as somebody went and sat with somebody through their treatment because they didn't have anybody to go with them. And so that's sort of the idea of these roles, that it's that supportive person.
That's really good to hear. Thank you. We've had a request about the presentation being shared afterwards. I think, Frankie, all the presentations are shared afterwards. Is that right? Or they're put on the Cancer Services Partnership website. Is that right?
Yes, I'm not sure whether they are all sent directly to Jackie, which I think they are. I know quite often. Sorry?
I can send mine to Jackie. So
yes, if you can. I mean, I'm not sure whether it's the usual process, but I know Jackie quite often has them because she's there in the background if something goes wrong with the screen sharing. But yes, if you could send your if you're willing to share your slides, if you could send them to Jackie Evans or even the Cancer Services Partnership email, then they will be available.
Yeah. And then, sorry, Katie, just a couple more. We've got where does dealing with side effects of treatment fit into this structure? As this is a very common problem for prostate cancer patients. So where does dealing with side effects of treatment fit into this structure? So what as in chemotherapy treatment, or? I think Martin, did you want to?
Yeah, can I just add to that? For example, Prostate Cancer UK have recently released some figures that show that men who have surgery for prostate cancer, 40% of them are likely to have incontinence problems. Erectile dysfunction is very common. Problems with bowel problems, diarrhea for people that have radiotherapy. Basically, no matter what sort of treatment you have for prostate cancer, it's highly likely that you're going to have side effects, some of which can be lifelong. And this is something that our group especially sees. It's a bit on the sideline, that you're pushed off all around the system, and there's no real coordination of what goes on.
Yeah, so I know that we have some issues with our urology pathway, and there is a project going on at the moment that I'm not actually directly involved with, but I know that Emily is working on that. So I would imagine that would be involved with that project, but I'll take that back to Emily and ask her to get in touch.
Thank you.
Thanks, Katie. And then I've got a couple more. How does the cancer nurse specialist know about like the cancer rehab options in the community? I know there's a new lead cancer nurse starting. It'll be good to, because and actually with this question, I think I agree, it'd be really, yeah, about connecting I think the cancer nurse specialists a lot closer, I think, with some of the communities that can offer the rehab for cancer patients.
Yeah, absolutely. And that's definitely where, you know, one of the things that's key to that role. With Lisa starting, we definitely want to be looking at how we work more closely with community providers, and how we can communicate what is available within the community.
Okay, thanks, Katie. And then I've got about how does Wessex Cancer Alliance, the NHS and HHFT work together for cancer?
So we work very closely. So Ruth, do you want to come in for that? Sorry, it's how we work with Wessex Cancer Alliance.
Oh, are you reading off some now? So how we work with Wessex Cancer Alliance, we attend regular meetings with them, and if they've got like regional plans of where they have finances they can spend to support the hospital or to roll something out on a regional level, and they get in touch with us, inform us about the projects, and they often fund our staff to kind of do a pilot for a year of certain roles. So lots of our cancer navigators are from the Wessex Cancer Alliance. So they're trying them out for a year to see how they improve the service and how they can improve the cancer patient's journey. And if they are good, either they might take on the funding in the long term, or they'll do a business case for the hospital to take on the funding. So they're kind of trying to support cancer patients kind of across the region rather than one specific hospital. They're helping us to give like an equity of service.
Right, thank you, Ruth. I do think we're just overrunning a little bit. So if there's any more questions, maybe we can get back to you rather than carry on too much here. Okay, so sorry about that, Martin, but if there's if it's possible to get back to you, then we will do. Okay, we'll move on now to Ruth. Lovely to see you here, Ruth. So I'll let you, I think everybody knows you, but if you'd like to introduce yourself, that would be great.
Hi, thank you. Thanks for passing over to me. So my name's Ruth. I think I've met most of you before. I am the matron for cancer services at Hampshire Hospitals Trust. I think I've been in the post for nearly a year now, so I've met most of you. Let me share my screen. I've got Katie sitting next to me who can help me if I've got an IT issue. So let's see. Am I? Where's it gone? There we go. So I am going to give you a little bit of an overview of the areas which I cover, but also showcase the services that we provide. Okay, so the cancer
just to let you know, we don't have it on full screen. We can see it, but we can see all your bits down the side. So full screen would be better, but if not, we can follow it as we are.
Bear with me. I'll email it across to Katie and ask her to share it on her screen because my software that I'm using doesn't allow me to do that. Perfect. Can you see it now? Because Katie's showing on her screen. There we go. Perfect. So next slide. So the cancer services at HHFT. So we provide a diagnostic, a treatment and support to patients within Hampshire Hospital Foundation Trust. We provide treatment for both haematology and oncology patients through their outpatient, so systemic anti-cancer treatment units, both in Basingstoke and also on the Winchester site. We also have a haematology follow-up clinics, which we provide in Andover at their hospital and also in Alton. And we have an inpatient haematology ward based at the Basingstoke site. And we work together with the Wessex Cancer Alliance, Macmillan, the ARC Charity, and also the Cancer Service Partnership. And we are part of the Wessex Haematology Network for the region. So our outpatient units, just to give you a little overview of them, we've got 2 SACT units, which are based, one on the Basingstoke site and one on the Winchester site. So the Basingstoke site is called the Rainbow Unit, and in Winchester it's called Nick Jonas. We've gone back to the original name there, just because everyone knows it as the Nick Jonas and it's signposted. And the Basingstoke site, we have actually had new signs put up. And if you actually look around for them, they are everywhere. So there are Rainbow Unit signs directing you to, because it's in the old building, which was a FIRS, and it was causing a little bit of confusion for our patients because there was no signposting for it. Okay. So both of the units have 9 treatment chairs and a line care room. They also have an acute oncology service, which I'll talk about in a little bit, and clinic rooms, and the slide's just saying where they're located. And the outpatient units provide the following services. So they have outpatient clinics for oncology and haematology patients, and they provide chemotherapy and systemic anti-cancer treatments, and they provide supportive treatments. We also have counselling sessions there and an acute oncology service, and the units open between 8 and 6 every day, well, Monday to Friday. And the units focus on delivering high quality, effective and compassionate care, and the staff there aim to meet patients' needs by providing holistic and personalised care. Each patient who attends for treatment is allocated a member of the nursing team who is responsible for administrating their treatment and looking after them during their stay. It might not be the same nurse each time they come for treatment though. The nurses understand that receiving the treatment is stressful for patients, and they're happy to discuss any concerns, and as well as the CNSs, the nurses on the unit can also refer patients to the appropriate services if they have any concerns. Across the 2 sites is the same nursing team, so they provide the same service on both of the hospital sites. The idea of the 2 sites is that patients receive treatment at the site which is closer to their home. The acute oncology service, so we've got a new lead nurse for this service, and it is run by a team of specialist nurses, and it's based on both hospital sites again, so in Winchester and in Basingstoke. The acute oncology team assists with advice about complications of chemotherapy, immunotherapy, targeted therapy, radiotherapy, and metastatic spinal cord compression. The acute oncology specialist nurses are available, so they work 8 till 6 Monday to Friday, and overnight the phone line is where patients can phone up with any concerns, is handed over to our inpatient haematology ward, who have access to consultants. So it means that patients can get special advice 24 hours a day, 7 days a week. The acute oncology service, they support patients through their cancer journey by providing advice on managing the side effects. They provide ongoing advice and support to patients and their families. They provide rapid referrals to specialists as required. They inform and provide a link for patients with their oncologists so they can get direct access to the oncologists. And they, if a patient is admitted, they work to reduce the length of stay in hospital by reviewing them. We also have an inpatient haematology ward. So the Wessex ward is our haematology inpatients unit. It has 10 private side rooms, and it also has an intrathecal room where they can do intrathecals, and patients can go in for bone marrows as well. And this is located over in Candover in the DTC on the Basingstoke site. So the Wessex ward is a diverse, multidisciplinary team of nurses, healthcare assistants, physiotherapists, dietitians, and a medical team. The Wessex ward are passionate at providing high standards of holistic care throughout the time, because it can be stressful for both patients and their families. They work in partnership with patients and their families to ensure that a patient feels comfortable and able to express their needs. The Wessex ward aim to provide high quality care to anyone requiring investigation or having treatment for a haematological cancer. This involves a multidisciplinary team facilitating a timely diagnosis and decision making of treatment. The team use evidence-based practice to provide the best treatment, and they also provide palliative care and psychological support. Our inpatients ward also work closely with our haematology CNSs. So when people become outpatients, their inpatient journey is the haematology CNSs are aware of what has happened while they're in inpatient. I want to talk about a few of our successes in cancer services, our recent successes. So WOW Award nominations. This is an award which is nationally accredited and it recognises excellent care. Nominations come from patients, visitors and colleagues, and the cancer service team continue to receive lots of WOW nominations across the whole multidisciplinary team. So I've got a few of the examples for you. So I've got thank you for everyone working on the Wessex ward. You looked after my husband and did your best, but it was not meant to be. You looked after him, but you didn't only look after him, but our sons and myself, which was a great comfort. Thanks for all of the cups of teas and coffee. I wish I could give you all a gold medal. Next one is Dr. X has shown compassion and respect every time I've seen him, and when speaking on the phone, nothing is too much trouble for him. He explains what treatment I'm having and why, and puts my mind at rest, so I'm not stressed when I have to go to the unit. And I've got two more multidisciplinary ones for you as well. So whilst working on Camp Welsh ward, I witnessed a staff member, X, come and visit a patient who was staying in hospital, whom she had built a relationship with while she'd been attending appointments at Nick Jonas. The patient lit up at seeing a familiar face and had a great time chatting. After the staff member left, it was clear it made a huge difference to their day, and they continued to talk to me afterwards about how much they appreciated the Nick Jonas team. And finally, for all of the nurses and doctors and everyone in the chemotherapy department, including the receptionists and volunteers, they all made all of my visits to the department enjoyable. They cannot do enough for you, and the compassion and respect is brilliant. I was petrified when I first started going for my treatment, but they took away the fears, and now it is more relaxed. Also, on the WOW awards, the Wessex wards, or inpatients haematology ward, have been presented with a milestone award. This means they've received 50 WOW nominations as a team, and they've currently had 42 WOW nominations just for their individual staff members on top of this. Another success is we've recently had the People's Award. So this is Hampshire Hospitals Trust's own awards, and it recognises truly remarkable and inspirational things that happen across the trust each and every day. So these nominations were made by colleagues and also members of the public. In cancer services, we did really well. So we had nominations for both of the outpatient units, the inpatient ward, the haematology CNS team, the SAC CNS team, our secretaries, our physician associate, and our operations manager. So kind of everyone on every spectrum got a nomination, which was really nice to see. It's just pictures of the People's Award. They had a little tea party to kind of celebrate for everyone who was nominated. Myeloma UK CSEP also award. So the Clinical Service Excellent Programme is a Myeloma UK programme which supports hospitals in delivering optimum patient-focused myeloma treatment and care. So the programme aims to recognise and share excellence in myeloma care and identifies any areas for improvement that can better meet the needs of myeloma patients. So the Myeloma Best Practice Standards is a framework for assessing the process, and these standards were developed by Myeloma UK in consultation with patients, family members and healthcare professionals. And the award has been presented to the teams on both the Basingstoke and also the Winchester site. So both of our haematology teams have received the award. And our final success is Emily Arbuthnot, who is the head of cancer services at Hampshire Hospitals. Katie mentioned her earlier. She has been awarded yesterday. today she's being awarded with an MBE for her service in the NHS in the Queen's Jubilee Honours List. So Emily's honour recognises the work she's done with Peritoneal Malignancy Institute, so a centre based at the Trust Basingstoke and North Hampshire Hospital, which specialises in surgical treatments of patients with tumours and cancer spread to the peritoneum. Under Emily's leadership and throughout the team's hard work, the centre has expanded significantly in the last decade, and with more surgeries and treatments carried out than any other facility globally. So we're really proud of Emily and the team for that award.
Well, thank you, Ruth. I really think that really tells the success story of our cancer services. I think we all feel totally indebted to what you do and the staff you have, and absolutely fabulous. Does anybody have any questions for Ruth? No?
I can't see any in the chat bar at the moment, Frankie.
Okay, then, well, we'll move on. But thank you, Ruth, so much. I think we all needed that as a real boost to how we feel about your services. We'll now move on to Julie. Is Julie here? I didn't notice when she came in.
Oh, I had a problem there getting rid of the mute button. I'm muting. So as you can see, lovely Michelle Urry has joined me. I think Michelle was on the list to actually give a bit of an update on the ARC. So that kind of falls into the update with what I've got to sort of say, really. So I haven't had time to actually prepare a presentation. I do apologise, because it is nice if you've got something visual to look at when a person is talking. But I hope I can give you an overview and enough information. So I think most of you know who I am. My name's Julie Walsh, and I'm the lead complementary therapist here based at Basingstoke in the Wellbeing Treatment Centre, which is part of the Wellbeing and Supportive Care Service that we have. So I'm head of the complementary therapy service. So we first began seeing our patients last October, and we have so far to date, we've had 175 referrals into the service. And currently, I think we've only got about 12 patients that I haven't managed to contact. So I'm currently seeing 100 patients, and I actually can't believe I'm saying that, because it doesn't, I just feel like I'm head down and I'm seeing all these people, but it's just amazing how it's grown, which shows to us there is a real need for the service. With the very kind support from the Art Cancer Charity, we are able to provide this service. Now, I'm sure most of you are already aware of us, but for those that aren't already aware of us, we're based in the radiotherapy unit at Basingstoke. We've got a beautiful wellbeing treatment room. And for anyone that would like to come over and visit at any time, please contact me. You can get my contact details afterwards. And contact me if you've got any, if you'd like to come visit, find out a bit more about what we do. But as I say, currently we've had all these referrals. I've built up a really good, strong relationship with a lot of the CNSs and the cancer support workers. And I think that's vital, because it's the teams that really get to know the patients and the patient's needs, and then they're able to identify what we can do. And we can come in where a lot of the patients have they're experiencing side effects from the treatment, right through from diagnosis all the way through. To support their well-being, to help them get a better quality of life and despite their diagnosis. So we have had most of the referrals, the majority have been from breast cancer services, but we've also had a lot of referrals from haematology. We've had some from urology. We're getting a few more now, and I know Martin, you're here. We have had quite a few come through from the prostate cancer patients as well. So that's good. And I think the message I want to sort of give everyone is really explaining that, you know, we can do so much. And I think when I've spoken to patients, and I always ask them, when I've received the referral and I speak to the patient themselves, I always ask them, you know, do you have any understanding of what complementary therapies are? And I find myself most of the time, you know, explaining what we do, because most people don't really understand, you know, what we actually do. So the referrals that we've received have been for many things, a combination, emotional symptoms, anxiety, stress, and fear, combined with, of course, the side effects of the actual treatments that patients are going through. And a lot of these can range from general sort of aches and pains. Sometimes patients, we've noticed, have been experiencing excruciating pain that, you know, that the pain medication given for them to help it just hasn't helped. And they're looking for something that, you know, can just provide a little bit more help for that. One of the other issues that we're finding a lot of, and particularly with prostate cancer patients, is peripheral neuropathy. So for those of you that don't know, the tingling, numbness sensation, a lot of it is the chemo-induced, a side effect of the chemo, where people are experiencing pins and needles, numbness in their hands and in their feet. And that can be quite debilitating for a lot of people, especially if they're trying to exercise more and keep themselves generally build up their fitness, and they find it difficult, you know, walking. So acupuncture is a very, very good modality for peripheral neuropathy, and our acupuncturist Ian Harrison has had some excellent results from patients receiving acupuncture. So I just sort of want to really sort of get that message out there. If you've got anyone you know that has peripheral neuropathy, then please, you know, forward a referral into us, because I know that we can help. Talking about acupuncture, Ian has in excess of 35 patients that he's seeing. He works just one morning a week with us at the moment. So because of that reason, we are looking to introduce bring another acupuncturist on board who will be able to assist Ian. And I know Ian's waiting list at the moment. Unfortunately, patients are having to wait until about end of May, beginning of June, which you know, but that just shows the need for that. So we're, as I said, Michelle and I are meeting with another acupuncturist tomorrow. So we're hopefully going to be able to bring her on board. And as well as that, we've got some good news, talking now mainly about breast cancer patients, and the patients that inevitably, not all, but many of them, will have the side effects from the post-surgery and the post-treatment is lymphedema. So we've got a wonderful manual lymphatic drainage specialist who's joining us literally now. We're just waiting for clearance from HR, and some of you probably know her, and her name's Gail Harbers, an MRD therapist, and I've already got 15 patients waiting to see her. So, you know, anytime now we can get her on board. Gail will be working with us every Tuesday afternoon. So that's really good news. So as you can see, we're growing. There will be 3 of us very, very imminently, and then soon, hopefully, there'll be 4. So the need for this service, I feel, is evident really with the number of referrals we're receiving. But I thought you might like me to share just a few of the comments that I've had personally from some of the patients. We've had literally hundreds of comments, but some of the more sort of poignant comments. So one here is from a lady saying this: cancer treatment is so brutal. To have something nurturing to counteract that is amazing. Replenishing you at a time when you're at your lowest, you cannot put a price on that. So that's the kind of feedback we're getting. Someone else here said, I was skeptical before I had a treatment, but after experiencing reflexology, I was blown away. And that was somebody that literally had never had any experience of any complementary therapy at all, and decided on the reflexology and was just couldn't believe it. And another lady said that the clinical treatments are exactly that, clinical, as good as they are, but coming to the Wellbeing Centre and having a treatment is helping with the whole, which is vital. So as we are very holistic, treating the whole of the patient's needs. And at the same time as saying that, I'd also like to say, I feel too that we work very closely with the clinical teams, with the CNSs, with the cancer support workers, with some of the consultants. You know, it's vital that we all work together, and not just here at HHFT, but again in the support services that are in the community with yourselves, you know, the CSP and all the other cancer support groups and charities and everything. We regularly signpost patients once they've finished with us, finish their treatments with us. We regularly signpost them back into the community, which is good. And yeah, so really that's just checking through see if there's anything else really to say. We have had some invitations out. I mean, and Martin kindly invited myself and Ian along to the prostate cancer support group recently, alongside I think we Sarah Sharp, the dietitian, came with us. And again, you know, it's all about integrating our services, because we work so much better if we all work together rather than just singularly. So networking and working together as a team is absolutely vital. But I think that really just summarises where we're at the moment. I know the ARC Cancer Charity are working hard. I know Michelle is working exceptionally hard, going out into the community and networking with all the different, well, obviously the trustees come together and work.
Absolutely, yeah.
You'd like to mention?
So I won't take up too much of your time, but as you were, Julie and the team have worked exceptionally hard to get this up and running. And as she said, it is important. I mean, I was at a group yesterday, and one of the things they spoke about was where else they can get other therapies, speak to other people within the community, because we only can provide the 6 sessions per patient. You know, there may be something that we might do to bring them back in if we feel they need an extra counselling session or likewise. But the importance of Jane Starr's House, Pink Place, all of you within the community for those extra supports that people need ongoing is vital. And I think that we are immensely happy to signpost people to those places, because I think people need choice. People need choice of where to go. And it's really, really important that we make sure everybody is aware of where they can go and what support they can get. I think that's the most important thing. Thank you.
Well, thank you very much. I know this has been a long time coming. We've been, can't think how many times we've been over to the Candover building and looked at it all and just waiting for it to start. But and now you've
such beautiful colours for the room.
Yes, I know.
Absolutely perfect. So
yeah.
Yeah.
Absolutely lovely. But now Julie's on board. I mean, goodness me, it's flying. Absolutely. Thank you so much. Does anybody want to ask Julie or Michelle anything? But it is a thank you to the ARC's Cancer Charity for getting this, for financing this and getting it going. And yeah, thank you very much.
We could have done it without the community. I think that's an important thing, that locally people are extremely supportive for such a small town. Very good people. Very lovely.
Okay, thank you. Is there anything else you would like to say to Julie or Michelle? No. Okay, then we will now move on. And it's okay for Beth to go on now?
Hello, yes, thank you very much.
Hello, Beth. Right.
Hello. Hello, I'm Beth. I also work for Hampshire Hospitals. I feel like it's been Hampshire Hospitals overload this morning, so I hope that you're not too bored of us all. For me, it's been really, really useful to hear more about cancer services and how it works. I'm fairly new to the trust. I've been here for 6 months, but I'm new to the NHS. I've spent the first sort of 15 years of my career working in adult social care, so I've stepped over the line into health, and it's been really interesting, and I'm still learning a lot. I'm the patient experience and engagement lead. I sit within the patient experience team, so that team includes the friends and family test coordinator, the customer care team, so that's the complaints and PALs, and also the patient information manager as well, and also the volunteer service. So it covers quite a big remit in patient experience. My role was created to develop and improve the way that the trust involves patients, carers and the community in developing services. In July last year, NHS England brought out some statutory guidance which states that health services, including acute trusts, must involve patients and carers when services are being created, but also if there are changes to services. So that includes if locations change, the ways that a service is delivered has changed. So involving people in those decisions and in designing what services look like is really important, and it's now a statutory requirement, which in a way does make my job a little bit easier. So some of the things I've been doing since I've started is I'm working closely with our quality improvement team and our research department to centralise our approach to involving people. It traditionally has been quite haphazard. In cancer services, obviously it's different because you've got the Cancer Services Partnership, which is established and has a brilliant relationship with cancer services. So there'll be a central approach. The website is going to change. There's going to be some branding, and once that's all established, I'll share that through Cancer Services Partnership, which will be great. I've also been working on sort of developing some relationships with the communities and the community organisations, which has been really, really fantastic. There's the communities around our hospitals are so rich. There's so many great things going on, and especially supporting people who are more likely to have poor patient experience, people who are more likely to experience health inequalities. So working with those community groups is a great way to find out what those patients are experiencing and what we can do differently to make those experiences better. So we've established the Health Involvement Network, which is where we facilitate a forum with local community groups. We had our first one in November. I'm going to pop a link to book onto the next one, which is at the end of this month. And that would be an opportunity to hear a little bit about what we know about patient experience, for community groups to tell us about what they're hearing from the people they work with, about what patients are experiencing. As a result of our first meeting, we've established an accessibility group, because we know that access is a big issue across all of our hospital sites. And we're working with the RNIB, which is the Royal National Institute for the Blind, are working with us, and they've come and done a walk round and identified some key areas that we need to be focusing on. Unfortunately, this work doesn't come with a pot of money, so it really is working with communities and individuals to agree what the best way to spend the money that we have in terms of accessibility. I'm also establishing an access experts group who will be overseeing the work that we're doing. So that's patients who are directly experiencing those barriers when they come to our hospital sites, to make sure that what we're doing is what needs to be done and what patients are telling us needs to be done. So that's really great. And a lot of the work I'll be doing as well is supporting staff that want to involve patients in changes to services. So I was just thinking that the chemo close to home project and the refurb at the Rainbow unit is a brilliant opportunity for patients and carers to be involved in making sure that those services are what patients need. So that's great that's going to be happening. So some of the ways that people can get involved with the hospital are taking part in ward accreditations, which is basically a walk around on the ward with some of our staff, talking to patients and staff to just see how we're doing and see what we could be doing better, see what's working really well, so that other areas can learn from different wards when they have different things in place. Working on quality improvement projects, or some of our quality priorities, which is a bit jargony, but essentially quality improvement projects are what it says on the tin. It's when an area identifies something that could be improved in their service, but patients should always be central to that work. So there should always be opportunity for patients to take part in that, or even sort of co-design some stuff. And there's some of that work going on, which is brilliant, and hopefully that will snowball and increase. There's opportunities to share your story, your patient story. We're looking at the best way to go about that. Again, this does happen. We record patients, and every board meeting and every senior management team meeting starts with the patient story. But we know that our staff really appreciate hearing and learning based on real patient experience. So we really want to improve the way we capture people's stories and people's experiences for learning and improvement. I'm working with a number of patients who I've got in touch with via, unfortunately, from the complaints process, who've had a negative experience, but they're really keen and really motivated to use that experience to make improvements. And it's fantastic that we're able to, that they're willing to work with us, and that we're able to move forward and make those improvements that they're suggesting based on those negative experiences. So we want to enhance that and increase the way that that's done. Also, our patient voice forum is going to be expanded, I suppose. So anybody who has an interest in the hospital but doesn't know exactly, what area they might like to get involved in, by being a part of the patient voice forum, there'll be sort of those open conversations, and all of the involvement opportunities will be shared through that. So that's really positive. So I'll pop the link to the Health Involvement Network in the chat. If anybody's got any questions about getting involved with the hospital, if any of my colleagues have any questions about how we as a team can support you to involve patients in and carers and community groups in what you're doing, then ask away or get in touch. And that's me. Sorry, I didn't bring a presentation. I have like a couple, but I sort of felt it was just best to give a bit of an introduction, and then I'll hopefully be able to come back in the future if I've got specific things to talk to you about.
Lovely, thank you, Beth. Nice to hear from you.
Thank you.
And I'm just love being here today. It's just talking to people who actually want to make a difference, and that just makes that big difference to cancer services. And thank you very much. Well, is there anything that you'd like to ask Beth? If not, we'll move on to Sarah. Are you okay, Sarah, to introduce yourself? You're on mute at the moment, Sarah.
Yes, hello, I'm so sorry. And we're actually dealing with the issue of being open or not because of the snow. And I'm actually having a conversation at the side with my centre manager about that. Operational matters at the same time as being on a Zoom call. My apologies, everybody. Thank you very much indeed for inviting me to join you this morning. I'm from the Cardiac Rehab Centre in Alton. I have just done a very short presentation to cover that. And I'm just going to make sure that the door is shut so that the conversations outside aren't going to interrupt us. One moment. So here we are. I'm Sarah Quarterman, the CEO at the Cardiac Rehab Centre in Alton, and with me today is Sarah Hill, who's the Health Programmes Manager at the centre. Now, let me just do a very short presentation for you. So, Basingstoke and Alton Cardiac Rehab Centre, why are we on a call about cancer care, you may well ask? It's just that the Cardiac Rehab Centre in Alton has been much more than just cardiac rehabilitation for quite a long time. It was started in that way. 40 years ago, Hugh Bethel, a GP with an interest in cardiology, realised that there wasn't any rehabilitation in the community for people who'd had a heart attack. And so he started doing exercise rehabilitation for that cohort of patients. But in 2009, we started working on a new idea called primary prevention of heart disease, obviously, because that was our specialism at the time. And that programme is called Stay Well. And that's really the thing that I want to talk about today. But I'll just step through a little bit of information about us. So what we do. We do cardiac rehab classes, of course, for those who've had a cardiac event. We have this programme called Stay Well, which is really a health education, a health exercise program for anybody who's got an underlying health condition. It is originally designed for people who are at high risk of having a heart attack, but in fact, it's suitable for all sorts of different things. And we'll go into that in a bit more detail in a minute. We also offer Steady and Strong, which is about falls prevention for people who might have been needing exercise to focus on their balance. And we do pulmonary rehab as well. So, you know, we're already not just about just heart at this centre. Where we are, you'll find us just at the back of the sports centre in Alton, quite conveniently located in terms of car access, also public transport with buses. We've got car parking dedicated for us, but it's also quite a lot of open parking around the sports centre too. Clearly it's free, which is always a benefit if you're coming to have some therapy here. What happens when you arrive? Well, the first thing you'll be greeted by a wonderful receptionist. We have a nice, quite open reception area where people will sit and talk and chat, and it's very much a service that offers the social side of interacting with people who are going through the same things that you're going through at the time. So it's a little, in that sense, it's like an outpatient clinic, but it's but we're not part of the NHS. We are a charity that's separate from the NHS. We are not funded by the NHS, and the services we offer, there is a charge, a sort of a service user charge of £5 a session when you come to the centre, because that's the only way we can be funded. We also do fundraising like any other charity to cover the costs of what we do. And when you come into the building to do some exercise as part of a rehabilitation programme, there's a sprung floor there, which you can see, which is where people do warm-ups, and then there are exercise machines just like a gym. A variety of different forms of exercise people do with us as part of primary prevention. It can be strength exercises and it can be cardiovascular exercises. And the key thing is that we tailor the programme that people have exactly to what the conditions that they have. So whether or not they are able to use to ride on a bike or use a treadmill, we will take a view about that when we're doing the programme for them. So here's a group of ladies and gentlemen all together warming up at the beginning of an exercise class. You can come and do exercise as a class at the centre, which means you're here for an hour with the people at the same time, or you can come and do your programme independently. And there's an independent slot available every day of the week. So it's, you know, plenty of choice for people about coming when they want to come in their working day or in their ordinary day. And we're open from 8 in the morning until 8 in the evening, most days of the week. Close a bit earlier on a Friday afternoon, and also we're open on Saturday mornings. So here's an example just to sort of give you the idea about what Stay Well can do. Here's a chap called Graham who came to our Stay Well programme. Obviously, this example is focused particularly on cardiac health, but he saw you know, improvement on all sorts of measures for blood pressure, weight, cholesterol, waistline, and his exercise capacity. Now, the thing about Stay Well, though, is it is basically taking exercise for the purposes of improving physical well-being and indeed mental well-being. And in addition to cardiac, we are now working alongside the cancer prehab unit down in Southampton that's running with Westfit, is running rehabilitation for people who are going to have an operation on their cancer. And we're very interested also in helping out with cancer rehabilitation for patients who've had cancer treatment. And we have here at Centre, we've got 7 instructors who are trained to level 4, as it's called, which is the highest level of specialist instructor training you can have. And of those, 2 are cancer rehab trained already. And also we've had 2 people trained in cancer prehabilitation. So the idea of coming onto the meeting today was really to find out how it is we can make our services more available to cancer patients in our patch. There, for instance, prostate cancer. We're aware that there is a group over in Basingstoke that does prostate cancer exercise, because sufferers of prostate cancer, you know, with the hormone treatment, lose muscle mass, and it's really important to keep that muscle mass going for your core strength and also your well-being, mental well-being, and that's something that we can easily offer here as well. But there are obviously all sorts of other types of cancer and all sorts of other suitable forms of exercise for people to undertake to improve their health and well-being. So my question on the chat earlier, when we were hearing from the cancer services overall presentation by Katie, was, you know, how does the cancer nurse specialist know about what's available in the community? And so we're an example really of a charity that can support the cancer sufferers in our patch by giving them either prehabilitation before an operation or rehabilitation after treatment. And that's what we'd like to offer to the cancer care, this partnership, to sort of promote what we can do. And I'm very interested in knowing the best people to get in touch with to sort of set out our services and what we can do. So are there any questions that you might have for me overall about what the charity does, but perhaps more detailed for Sarah as to the sort of cancer programs that we're going to be offering? Anybody, any questions? Marianne, I haven't even looked in the chat. You're still on mute, Marianne. Marianne, you're still muted.
Oh, I thought I might end up doing that. Sorry, my camera's off there. Yeah, thank you very much, Sarah. I think that was really helpful for, like you say, to explain what you deliver at the Basingstoke and Alton Cardiac Rehab Centre, that it isn't just for heart patients, and that the centre can support cancer patients as well, and how well set up it is to do that. So thank you. There is a message in the chat says, is there any plan to hold sessions locally? Sorry, Frankie, I don't know if you want to expand on that.
Yes, it just sprung off in my brain. Many years ago, when my husband had a heart attack, he had cardiac rehab, and they used to hold sessions in Tadley, and it was absolutely brilliant because he would attend. if he'd got to travel to Alton, he wouldn't have bothered. And so if it was possible to have these sessions locally or attach yourself to a gym or something, it just might encourage more people. So I just wondered if you've got any thoughts on that for going forward.
So are you saying it was one of our exercise instructors that came to Tagley to run the sessions?
I think so. It was run out of Trelawn's Hospital, so I'm not quite sure.
Yeah, okay.
But
so the answer is we can you can get can rehab locally. I mean, the thing is that most sports centres have got exercise specialists. The question is whether they've got them trained in can rehab. One of the things that we do is that the way it works is that anyone who comes to us on the Stay Well programme, they come here first for an initial assessment. So that means that we talk them through over a course of an hour about their fitness levels, what they can and can't do, the particular needs they have, depending on the cancer they've had, and what's best for them. Now, that doesn't mean to say that they can't then go and have a programme in a local sports venue. And what we've said, that's not, I mean, it would obviously be easier for us to monitor how they're doing if they're here. We don't have any outreach programs in place at the moment, and the reason for that is because we're not full. And so it's currently, we're keen to make sure that we're using the facilities we have here before going out to other places. But there may be a question, that may be a question for the wider sort of exercise on referral groups that exist with the various leisure centres, around our patch, Everyone Active being particularly one in East Hampshire. I know that they're very keen on doing all sorts of different types of exercise on referral, but I don't know whether they're covering cancer rehab or not.
Thank you very much. Well, we've now, if there's no more questions for Sarah, as we've got a bit of time, it would be nice if we can go back to the Martin question that we missed earlier. Can we do that, Marianne?
Yeah, that's fine. And thanks again, Sarah, for coming. I think it's really useful to know about what services are available. And I know there are patients that, because they really enjoy going to, like with the atmosphere and the support they get at the Alton Basingstoke centre there, that there are patients who are very happy to travel that little bit further, but also for the needs of the local population there as well, with what you're doing with Stay Well and cardiac and cancer patients and falls prevention. So it's been really helpful to have that update. Thank you. So Martin had a question. I think it was, what is the difference between a pathway navigator and a support worker? And how do patients get informed about these roles, contacts? Because Martin had never been told anything before. So I don't know if there's someone that can answer that question.
Yes, I've heard about these roles through these CSP meetings. Our support group some time ago had one of the support workers come to our group meeting, told a wonderful story. But then we were told a couple of months later they'd been redeployed elsewhere, and there weren't any support workers for prostate cancer. So just interesting to find out, how this all works in practice, because our members are not really hearing anything about it.
Oh, you're on mute, Frankie.
Yes, sorry. It sounds like this is a question that we need to take away again then, Martin, and address it. Okay, and so then we can get back to you. If that's all, then I shall do a wind-up session. But I don't know about you, but I've thoroughly enjoyed today. I've learned a lot, and it's really good to know what cancer services do for us all, and I just thank you so much for all your input. And if anybody,
I'll ask one more question, Frankie.
All right.
It was specifically, if we wanted to, I'm very keen to sort of get on and do more on the cancer rehab angle. If we wanted to write to people to say, this is the service we offer, this is how it would work. And I'm not talking about patients, I'm talking about the healthcare professionals who are on the cancer pathways. who are the individuals that we should be talking to? And I guess this might be a question for Katie Thompson on the cancer care pathways, because you know, is it the clinical nurse specialist, in which case is she the right person to write to then pass information on to the right individuals at HHFT, etc., etc.
I think sorry to come in. I was just going to say, I think it would be really good, Sarah, to when Lisa Young, the new lead cancer nurse, starts, which is she's due to start in April, was to meet with yourself, just to maybe connect some of this up, because I think having that it's I don't think they're still on the call, actually. I don't think Katie's still on the call, but it would be quite good, I think, to have that closer connection, I think, with HHFT for yourselves.
Yeah, thank you. We'll do that. Thanks, Marion.
There we go. Okay. Right. Well, I think we'll call it a day, and I just thank you so much for attending. Pam, is there anything that we need to say or anything? No. And well, thank you for your help, Pam, and thank you, Marianne. And been very enlightening meeting. And just thank you for HHFT Cancer Services and everybody that does all they can for cancer patients. I just know it's totally appreciated. And
sorry, Frankie, there's one more question. Kathleen's said, I think Macmillan or Wessex Cancer Alliance have been mapping cancer prehab and rehab services recently. Have you been in touch with them, Sarah? I think
yes. I answered her directly. Thank you. Yes,
yeah.
We're going to do that.
Okay, yeah.
Thank you.
Yes, which we know you. Yeah. So thank you, Kathleen, for raising that. It's always good to make sure everyone's connected.
Okay, then. Well, thank you very much, everybody, and thank you for coming. And we'll see you next time. Bye.